Southpaws. Today we've got this poor little whippet that was running in the park and ran into something sharp. And so it had a primary closure done at the emergency center and has had necrosis of this area here. And so we're just going in and doing a revision on it. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So the first thing that I'm going to do is debride the wound, because as we know, with wound healing, the inflammatory phase, the purpose of the inflammatory phase is to get rid of any infection or necrotic tissue, and it gets trapped in the inflammatory phase until all the infection is gone, and you can't get rid of the infection if you still have necrotic tissue. So most important part when you're managing a wound like this is to get rid of all the necrotic tissue so that you can go from the inflammatory phase into the proliferative phase of wound healing. So just debriding away. I'll probably go ahead and debride this stuff as well. So again, most important part of management of a wound and getting it to progress with wound healing is to get rid of all the necrotic and infected tissue. Some of this stuff may be just partial thickness. Necrosis here. And then we'll get into this big part of the wound here. Just removing that kind of eschar. I guess eschar is technically just with burns, but we do have some nice granulation tissue underneath. This was explored previously. If this had been a bite wound, I'd be more concerned about a deeper penetration and potentially penetration of the chest cavity causing, number one, pneumothorax, potentially pylothorax. And so those types of wounds, dog bite wounds of the chest wall, should always be explored. Get rid of this guy. Go ahead and lavage this a little bit. Let's get suction. Yep. We'll just hold on. Just okay. Can you guys hear me? No, I think you can. Can you confirm, please, that you guys can hear me? Somebody says that they lost sound, but I can see the bar going up and down, and so I think that you guys can hear me. Can I get a confirmation, please, that you guys can hear me? Give it just a second. There's often a little bit of a delay. Sound is good. Yeah, great. Thanks, Dylan. Dylan, I haven't heard from you in a while. All right, so what I'm going to do here is I'm just going to undermine the skin here a little bit. the edge just so it closes a little bit. When I say I'm not cleaning it up because of wound healing, I'm just cleaning it up so that the edges oppose a little bit more nicely. And this thin-skinned dog and short hair, the scar is really going to show up. Now I'm going to just close this primarily, and then if I'm concerned about tension, I'll just do a z-plasty afterward. Okay, so that's pretty good there. Can I please get some 2O PDS? I do have a bunch of surgeries today. It's just a matter of whether I can get to them, number one, and number two, whether we can live stream. It just depends on what room I've been put in and stuff like that. So I've got a couple of BOAS, as in brachycephalic airway syndrome cases to do. One of them is a revision on a case that I operated on about 4 years ago, and it has developed recurrence of clinical signs. Just trying to release the adherence of the skin. So that's under a bit of tension, so I'm probably going to have to do a z-plasty there. This looks like it's got plenty of room. So I'll try to close this in a couple of layers if I can. So the plan here is just a primary closure and then possibly a z-plasty if it's under tension. Excise that cutaneous trunci there. I'm afraid that it's going to pooch out through the wound. That's a technical term, pooch. And honestly, if we had just debrided this wound, it would have healed by second intention. And the primary closure did not fail, except for the fact that the skin necrosed. So what happened was that the blood supply was compromised with the original injury. And so they did an appropriate primary closure. But then with the compromised blood supply, we just had necrosis of a triangle. The ventral aspect of the wound. I'm trying to close this in a couple of layers. Number one, to close dead space, and number two, to reduce tension on the skin edges. And I did warn this owner about the potential for a z-plasty. And I gave them about a 5% chance that it would break open again. Figure out if I'm going to do anything with this. A little bit redundant skin there. also trying to avoid little corners like this because that's more likely to become avascular. A little bit more bleeding there. So to review the phases of wound healing, you have the inflammatory phase. Well, the first thing that happens is the blood clots. And then neutrophils come into the wound to clean up the inflammation, to clean up the infection. So that's called the inflammatory phase. And then once the infection has been completely resolved and the wound is essentially sterile, then the proliferative phase starts, and that's when fibroblasts move into the wound. That is all directed by the macrophages. So the macrophages are like the orchestra conductor. And you have all kinds of growth factors and things that are responsible for influx of different types of cells into the wound. And then after about 2 weeks, the fibroblasts that are producing collagen become myofibroblasts, so they actually develop actin and myosin filaments, which then pull the wound together. So they actually, the fibroblasts further differentiate into muscle cells, or myofibroblasts, where they actively pull the wound edges together. During that time, you also have, so you have contraction, and then you have reepithelialization, which comes in from the edges. And then at the end of the proliferative phase, it moves into the remodeling phase, where you have the collagen, which was random initially, then becomes organized along lines of tension so that it becomes a lot stronger. And this is one, so everybody asks about Manuka honey. Manuka honey it actually slows down wound healing in sterile wounds, but in wounds that are infected, it accelerates wound healing. So this is one that if I couldn't close completely, I would think about Manuka honey. Can I get some more 2O, please? So now I'm just going to assess tension. It's actually not too bad. There's a little bit of tension right in here. So I've got a little bit of extra skin in that direction, but not a lot in this direction. We get another 2O PDS, please. I'll get you started at the top end. We're just going to put in some cruciate sutures. So there's a question about magnification loops. I have two pairs of loops. I have Heine loops, which are kind of the Rolls Royce of magnification loops, and mine have a portable LED light that sits on my head, and they're really, really nice. They're also really, really expensive. So I have just bought some Rose Micro Solutions loops, which are a lot less expensive, and they're just kind of built into some Ray-Ban glasses. And they were, I think, $600 US or $800 US, something like that, without any kind of light. And then you can get a light for another $600 or $800 on top of it. So they seem to be very good quality. I haven't used them for a lot of surgeries, but I've been pretty happy with them so far. I like 2.5 times magnification, and my working distance that I use is 40 centimeters. I like my surgery table fairly high, and so that's why I like the shorter focal distance. And these skin sutures I'm putting in, I'm not actually leaving them as loose as you normally leave skin sutures, because I actually want to reduce the tension at the skin. So I'm not just trying to oppose the skin edges, I'm actually trying to use it for tension reduction. Can I get a Sharpie, please? Thank you. I'm going to teach you some tricks with z-plasties as well. Skin there. Can I get some more 2.0 PDS, please? Thank you. Have a hello from Canada. Hello, Canada. Portland, Oregon, I saw before. I think I saw Egypt. And maybe Mexico. I've been teaching so many courses lately. I've had one each for the past, I think, 3 weeks. And then I've got 2 this week in Brisbane. So they're definitely keeping me busy. And the courses are free for people that work at Vet Partners practices. So Vet Partners is the corporation that bought our practice. 260 vet practices in Australia. So there are apparently a lot of vets that want to learn about wound healing and abdominal exploration, because I seem to be doing those all the time now. All right, so when we are thinking about a z-plasty, what we're trying to do is we're trying to take extra skin perpendicular to the incision, I guess extra skin parallel to the incision, into extra skin perpendicular to the incision. So what I'm doing is I'm palpating what direction I have the most extra skin in. So it's exactly like this, which is perpendicular to the incision, and I have least skin in this direction. And so what I'm going to do is I'm going to draw a horizontal line perpendicular to the incision, like this, and then I'm going to draw another line at a 60-degree angle and a 60-degree angle. The way to remember what a 60-degree angle looks like is it's an equilateral triangle. If you imagine this, equilateral triangle has 60 degrees at each corner. And so then I make my initial incision like this, another incision like this, another incision like this. And let's, before we do that, get some indication of the length of our, where's our Sharpie? So initially, this is the length of that segment, like that. And then we'll see how much skin we have in that direction when we're finished. And so I'm not going to have this patient on antibiotics after surgery. It's been on a course of Clavulox already, and so I am not concerned about further infection. I know that that sounds like heresy. Everybody's thinking I should have this dog on antibiotics, but we have to really reduce the amount of antibiotics, or the number of antibiotics that we use in our patients. Try to avoid antibiotic resistance, as our new nurse Katie said. That was you, wasn't it? All right, so now we pull this like this, and look at all this extra room we have. We almost doubled that length. So now, skin's not under any tension. And then, really important when you're doing z-plasties is to make sure that you completely release those flaps of skin. Okay, so we were like this, now we're going to be like this. And look at all that extra room that we've got there. I love a z-plasty. I start my closure usually with a little interrupted suture at each corner. Do you want to do the other corner there, Luke? We're going to go deep, try going deep to superficial, and then superficial to deep. So come, yeah. So we're going to bury that knot. So we're going, so deep to superficial. Yep. And then superficial to deep on that tip. So there's a question about whether we'd ever consider like tension relieving sutures over this incision, and you certainly can do them. The other thing I've seen people do is put extra sutures over a roll of gauze or something overlying the incision, which I think also can work quite well. Given the fact that we've done the z-plasty and the skin's not under any tension anymore, I think we'll be okay. So just kind of intradermal in the cutaneous trunci muscle, and then we'll do cruciates in the skin. Yep. I've already answered that. Yeah, thank you. Can I get some more 2O PDS, please? All right, so I will leave you to close the rest, and I'll just make sure there aren't any questions that I haven't answered. So I'll just come over to the stream and make sure there isn't anything that I haven't answered already. All right, so I think that's pretty, question about why I think the primary closure failed is there just would have been damage to the blood supply initially, and as a result, we got necrosis of the skin. That's the only issue. All right, so this surgery was not done with us originally, and so we charge full price for this, which is about probably 3,800 Australian, probably about 2,500 US. If we had to go back and do another revision, we just wouldn't charge a professional fee. So anyway, well, thanks a lot for watching. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And I hope to be streaming something else today, but we'll see how we go. Anyway, thanks a lot, and I'll talk to you soon.